Rwanda was part of a number of East African countries which recorded the first Marburg outbreak on the 27th of September 2024. Although the government says it is taking drastic measures to contain the situation, countries such as the United States of America have issued high levels of travel advisory for persons coming from the East African destination. Speaking at the Biahsara Afrika Summit Organized by the African Continental Free Trade Area in Rwanda, Kaseya, Director General of the Africa Centers for Disease Control and Prevention, says Rwanda ought to be commended for their control measures.
This decision is led by, as you saw, the level 3 status issued by the government of the United States of America regarding the Marburg outbreak in Rwanda. I challenged them. I told them yesterday, this decision is unfair, is unacceptable, especially for a country that is doing more than all of us in the world are doing, including the US. Let me reassure you that this decision is not evidence-based.
As of the 8th of October 2024, the United States reports indicate that 56 illnesses and 12 deaths were recorded from the Marburg virus. The country's President Paul Kagame says Rwanda is working to contain the situation.
It took some amount of courage to proceed to head to Kigali from wherever you were because of what my friend Dr. Kaseya said, head of Africa CDC, of the virus that has been going around, but well controlled. Marburg Virus. And from that, indeed, there was a bit of panic. Today, I want to assure you that Rwanda is doing whatever we can to contain and control this virus.
Some of the countries attending this year's Biahsara Afrika Summit say the situation in Rwanda calls for the need to scale up intra-African trade, especially in the pharmaceutical sector.
Their call to action. They highlight immense untapped potential that our continent holds and underscore the urgent need for transformative solutions. Today, our resolve is further tested by the triple C's: COVID, conflict, and climate change. The COVID-19 pandemic devastated our economies and disrupted value chains, exposing the perils of vaccine nationalism and the need for resilient local production capacities. The operationalization of the AFTA now stands as a source of pride and hope for the continent.
By the year 2040, Africa Centers for Disease Control and Prevention plans to produce 60% of the vaccine needs of the continent, which the African Union believes will reduce the reliance on foreign countries for the health needs of Africa.